When you hear about the opioid crisis, your mind probably goes to the tragic and very public toll of overdose. But there's another crisis, a hidden one, unfolding inside the body. It's a direct and devastating assault on our most vital organ, the heart. Today, we're going to uncover that story, because really, understanding this connection is the key to grasping the true scale of this epidemic.
All right, to really wrap our heads around how big this is, let's just start with one staggering number. In 2020, opioids were involved in nearly 75% of all drug overdose deaths in the United States. Think about that for a second. 3 out of every 4. This isn't just some side issue, it is the absolute epicenter of the overdose epidemic.
And look, this didn't just happen overnight. This is a crisis that has been building and escalating for more than 20 years. It's been growing, changing, and morphing into even more dangerous forms. This isn't a static problem, it's a runaway train. And if we want any chance of slowing it down, we first have to understand exactly how it works.
So here's the game plan. We're going to break it all down. We'll start with the quiet damage opioids are doing to the heart, then we'll dig into the powerful science of how addiction really grabs hold. After that, we'll zoom out and see how this whole crisis exploded over the last few decades, and finally, we'll bring it home, looking at how this national issue creates a real ripple effect on our workplaces and what it takes to build a safer environment for everyone.
Okay, let's dive right into the heart of the matter. Literally. How in the world do these drugs, which are supposed to just block pain, end up launching this all-out assault on our body's engine? Well, it's a complex process that all starts with how opioids interact with our central nervous system.
So one of the first things that happens is that opioids mess with the heart's rhythm. See, they're depressants, which means they slow everything down, including your breathing. When your breathing gets too slow or shallow, the oxygen level in your blood starts to drop. And when you're not getting enough oxygen, that's called hypoxia. It wreaks havoc on the delicate electrical signals that keep your heart beating steadily. This can lead to an irregular heartbeat, or arrhythmia, which over time can seriously increase your risk for things like stroke and heart failure.
Then there's another really serious risk, especially for people using needles, and it's called endocarditis. This is a nasty inflammation of the inner lining of the heart chambers and valves. Basically, bacteria or fungus can get into the bloodstream and set up shop right in the heart. And this is no joke. It's a life-threatening infection that can permanently destroy parts of your heart and requires some really aggressive medical treatment.
And believe it or not, the list just keeps going. The constant strain from irregular heartbeats, the damage from infections, and the direct effect of the drugs themselves, it all adds up. It creates this whole cascade of heart problems. We're talking about a huge spike in the risk for everything from heart failure and stroke to dangerously low blood pressure and even that terrifying feeling of heart palpitations. The bottom line here is that opioid use turns the body into a hostile environment for the heart, attacking it from all sides.
Now this is where things get, well, really chilling. This quote right here, it highlights just how sneaky and deceptive an opioid-induced cardiac arrest can be. It doesn't look like what you see in the movies. No dramatic collapse, no clutching the chest. It's quiet. It looks like someone is just drifting off to sleep. And that, right there, is what makes it so incredibly deadly.
Okay, this chart really breaks down the key difference. In a typical cardiac arrest, the heart itself usually fails first, some kind of electrical problem. The heart stops, and then, because of that, breathing stops. With opioids, though, the whole thing gets flipped on its head, and it's absolutely tragic. The drug tells the brain to stop breathing, so breathing gets slower, and then it just stops. The heart, now starved for oxygen, tries to keep going, but it can't, and it eventually stops too. All the while, the brain is being slowly strangled of oxygen, leading to devastating damage.
So that begs the question, right? Why would anyone keep using something so dangerous? To get that, you have to understand the powerful science behind addiction. It's not a character flaw or a moral failing, it is a neurological trap, and it's incredibly hard to escape.
It all starts with that initial feeling, that rush. Opioids basically hijack your brain's reward system, flooding it with feel-good chemicals. But your brain is smart. It tries to keep everything balanced, so when it senses this massive artificial flood, it dials back its own production of those chemicals. That leads to tolerance. Now you need more of the drug to get the same effect. And pretty soon, it's not even about getting high anymore. It's about needing the drug just to feel normal, just to avoid the absolute misery of withdrawal. At this point, the drug has basically hijacked your body's survival instincts.
And speaking of that misery, let's talk about withdrawal.
Trying to quit opioids puts the body and mind through an unbelievable amount of stress. And all that intense stress can actually trigger a very real heart condition with a very fitting name: broken heart syndrome. It's this sudden, shocking weakening of the heart muscle, a direct physical reaction to a massive surge of stress hormones.
And here is the most heartbreaking irony of all. The very act of trying to save yourself, of fighting through the agony of withdrawal, the anxiety, the racing heart, all of it, that fight can literally break your heart. The battle to get your life back could put your heart in immediate danger. It's a cruel, vicious cycle that just shows you the incredible power that addiction has over the entire body.
So how on earth did we get to this point? I mean, a crisis this big doesn't just pop up out of nowhere. To really get it, we have to look back at the history, which experts have broken down into 3 distinct and devastating waves.
Okay, so Wave 1 kicks off back in the 90s, and it was all about prescription pills. There was this big push to treat pain better, and you had drug companies marketing these pills as being safe and not very addictive. That led to a flood of prescriptions for drugs like Oxycontin. Then around 2010, things started to tighten up, and those pills got harder to get. So many people who were already dependent switched to heroin, which was cheaper and easier to find. That's Wave 2. And then, starting in 2013, the game completely changed. Wave 3, the one we're in now, is all about super powerful synthetic opioids like fentanyl, which sent overdose deaths into the stratosphere.
And you gotta understand, this didn't happen by accident. It was driven by massive systemic failures. You had misleading marketing. You had that infamous revolving door, where government regulators would end up working for the very companies they were supposed to be watching. And of course, more recently, the pandemic, with all its isolation and stress, just poured gasoline on an already raging fire. So when you look at all of this, the marketing, the policy, the pandemic, it's a tangled mess. But what do you think is at the core of it? Is it corporate greed, bad government policy, or something else entirely? I'm genuinely curious to hear what you think is the single biggest reason this crisis is still so hard to control. I'd love to see what you think. Drop a comment below and let's talk about it.
Okay, let's shift gears now and bring this huge national crisis right down to where many of us spend our days, the workplace. Because the impact of opioid use doesn't just stay at home when someone punches the clock. It creates a ripple effect, and it puts everyone at risk.
And this is a really critical point to understand. An impaired employee, it doesn't matter if they're a pilot, a forklift operator, or working at a desk, is a safety liability. We're talking slowed reaction times, bad judgment, drowsiness, all of which can lead to a disaster. And those accidents don't just put the user in danger, they endanger coworkers, customers, everybody. Suddenly, one person's private struggle becomes a massive safety risk for the whole team.
This is exactly why having a rock-solid, drug-free workplace policy isn't just nice to have, it's absolutely essential. And that policy needs to be crystal clear. It has to spell out exactly what you're testing for, when you test, like after an accident, how you handle it if someone refuses a test, and then what the clear consequences are for a positive result. When it comes to this stuff, there's no room for gray areas. Clarity is key.
And hey, if you're watching this and you're in management, HR, or a safety role, this one's for you. What's the biggest real-world challenge you run into trying to keep your workplace safe and drug-free? Is it the logistics of getting tests done? Is it legal stuff? Or maybe pushback from employees? Share your experience in the comments. I think your insights could really help other people facing the same things. All right, this leads us to our final and maybe most important section. Moving from just having a policy to building a workplace that is truly safe. It's not about a rule book sitting on a shelf. It's about a system built on one key principle: readiness. Being ready to act the right way, right away, when something goes wrong.
Because you have to remember, the second an accident happens, a clock starts ticking. For a lot of industries, especially anything regulated by the Department of Transportation, post-accident testing isn't a suggestion, it's a federal mandate with incredibly strict deadlines. In that moment, scrambling around trying to figure out what to do is not a strategy. Compliance is absolutely everything.
So in a perfect world, what does that post-accident response actually look like? Well, first, you secure the scene. You make sure everyone's okay. Next, you have to figure out immediately if a test is required by law or your own company policy. And step 3 is where readiness is make or break. You have to get that test started right away. Trying to find a qualified collector at 2 a.m. on a Saturday is a recipe for disaster. And finally, the whole thing needs to be transparent, with real-time updates so you have a clear, documented record of everything that happened.
So what we're really talking about here are the 4 pillars of a modern, truly ready safety program. First is speed, because every single second counts when you're up against those regulatory deadlines. Second, compliance, so you can navigate that maze of rules without fear of penalties. Third, accuracy, which means reliable, real-time tracking that you can trust. And finally, convenience, bringing the test right to the site, which gets rid of all the hassle and downtime.
Wow, we've covered a lot of ground today, haven't we? We went from the damage happening inside a single heart cell to the massive systemic failures that fueled this crisis, and all the way to the practical steps that can make our workplaces safer. The first step to fixing any problem is to truly understand it, and now you do.
Hey, if this explainer helped you understand this issue a little better, do me a favor and hit that like button. And make sure you subscribe to our YouTube channel, Read It Collect, so you don't miss what's next. And please, feel free to share this with anyone you think needs to see it. Thanks so much for watching.